know the signs of a stroke? Let's delve into that today. A stroke is a serious medical condition that occurs when the blood supply to part of the brain is cut off. It's a life-changing event that can alter the course of one's health significantly. Understanding what a stroke is the first step towards prevention. It's like a brain attack, striking swiftly and without warning. In just a blink, it can rob you of your speech, your ability to move, and even your memories. But here's the good news. The majority of strokes are preventable, and knowing the signs can make all the difference. Quick action can help save lives and reduce the long-term effects of a stroke. Knowledge is power, and we're here to equip you with that power. In the next few minutes, we will explore the signs of a stroke and how to prevent it. Recognizing the signs of a stroke could save a life. Let's dive into these signs so you're prepared if the need arises. Remember, time is of the essence when dealing with a stroke. One of the most common signs of a stroke is sudden numbness or weakness, often affecting one side of the body. This could occur in the face, arm, or leg. You might notice a sudden drooping of the face, especially on one side. This happens because a stroke cuts off the flow of blood to the brain, causing cells to die and thereby affecting the body's usual functioning. Another sign to look out for is confusion or trouble speaking or understanding speech. Someone experiencing a stroke might slur their words or have difficulty putting sentences together. This occurs because a stroke can affect the parts of the brain responsible for language and cognition. Next, let's talk about vision. Difficulty seeing in one or both eyes is a sign that should not be ignored. A person may report blurred vision, double vision, or even a complete loss of sight. This happens when the stroke affects the part of the brain that controls visual processing. Severe headache is another telltale sign of a stroke. This is not your typical headache. It comes on suddenly and is often described as the worst headache of one's life. It's different from a migraine or a tension headache. This occurs when the blood flow to a part of the brain is cut off, or when a blood vessel in the brain bursts, causing a sudden severe headache. Lastly, it is crucial to note that these signs can occur individually or in combination. And remember, these signs can strike suddenly and without warning. It's essential to act fast. Face drooping, arm weakness, speech difficulty, time to call emergency services. Knowing these signs is crucial, but prevention is always better than cure. In the next segment, we'll discuss factors that increase stroke risk and how you can prevent this life-threatening condition. Stay tuned. What makes you more susceptible to a stroke? Well, several factors can increase the risk of a stroke, some of which we have control over, and others not so much. Let's delve into these factors. Firstly, age plays a significant role. The risk of having a stroke approximately doubles for each decade of life after age 55. While strokes can certainly occur at any age, the older you are, the greater the risk. Family history also contributes. If your parent, grandparent, sibling, or child has had a stroke, you could be at a higher risk, particularly if your family member had a stroke before reaching age 65. Now let's talk about high blood pressure. It's the biggest contributor to the risk of stroke in both men and women. Maintaining a blood pressure level of less than 120/80 is one of the most effective ways to prevent a stroke. Smoking, too, significantly ups the risk. Nicotine and carbon monoxide in cigarette smoke damage the cardiovascular system and pave the way for stroke. The good news is, quitting smoking can significantly reduce your risk. Moving on to medical conditions, some also increase stroke risk. Conditions like diabetes, high cholesterol, and obesity are all linked to stroke risk. Moreover, conditions that affect your heart, like heart failure, a defect, or an irregular heartbeat, can also predispose you to a stroke. And lastly, your lifestyle matters. Lack of exercise, a diet high in saturated fat and cholesterol, heavy or binge drinking, and use of illicit drugs can all hike up your risk of a stroke. While some of these factors are beyond our control, like age and family history, many are within our reach to change. High blood pressure, smoking, certain medical conditions, and lifestyle choices are all areas we can work on. Remember, prevention is always better than cure. While some factors are beyond our control, there are steps we can take to reduce our risk. How can you prevent a stroke? It's a question worth pondering, and the answer lies largely in leading a healthier lifestyle. Firstly, maintaining a healthy lifestyle is crucial. This includes keeping your weight in check. Obesity is a known risk factor for stroke, so it's important to manage your weight effectively. Eating a balanced diet is a key part of this. Try to eat plenty of fruits, vegetables, lean proteins, and whole grains. Limit your intake of saturated fats, trans fats, and cholesterol. And remember, moderation is key when it comes to salt and sugar. Regular exercise is another cornerstone of a healthy lifestyle. Aim for at least 30 minutes of moderate intensity physical activity most days of the week. This could be as simple as a brisk walk or bike ride. Not only does exercise help to control your weight, but it also helps to lower your blood pressure and improves your overall cardiovascular health. Stress management is also important. Chronic stress can raise your blood pressure, leading to a greater risk of stroke. So it's important to find healthy ways to relax and unwind. This could be through yoga, meditation, or simply spending time with loved ones. Regular health checkups are an essential part of stroke prevention. These checkups allow your doctor to monitor your blood pressure, cholesterol levels, and blood sugar levels. These are all factors that can contribute to stroke risk. If any of these levels are high, your doctor can help you develop a plan to bring them down. Lastly, if you smoke, quit. Smoking can double your risk of stroke, and if you drink alcohol, do so in moderation. Excessive drinking can lead to high blood pressure, among other health problems. Remember, preventing a stroke is not a one-time event, but rather a lifelong commitment to healthier habits. It's about making choices every day that will keep your heart and brain healthy. Preventing a stroke is in your hands, and every step counts. We've covered a lot today, and it's time to wrap up. We delved into understanding the concept of a stroke and its grave implications. We learned about the critical signs of a stroke, such as sudden numbness or weakness, confusion, trouble seeing, and difficulty walking. We also explored the factors that can increase the risk of stroke, including high blood pressure, obesity, and smoking. We then moved on to the crucial focus of stroke prevention. We discussed the importance of maintaining a healthy lifestyle, regular checkups, and promptly addressing any health anomalies. Remember, early detection and prevention are the best ways to tackle a stroke. The knowledge we've shared today isn't just for you, it's for your family, your friends, and your community. Health is a collective responsibility, so don't keep this information to yourself. Share it, discuss it, and make it a part of your everyday conversations. Remember, your health is your wealth. Stay informed, stay healthy, and share this knowledge with your loved ones to create a healthier community.